Okay. Okay, great. Good evening. My name is Dr. Elena Rios. I'm President and CEO of the National Hispanic Medical Association. I'm very delighted that you are joining us for our sixth COVID-19 virtual briefing. We started our briefings last April, had 4 of them last year in 2020. And then we had 10 webinars with our NHMA, National Hispanic Medical Association chapters in September and October. We just completed another COVID-19 briefing in January, and you can find all of them on our website. I just wanted to give you a few housekeeping comments before we start. We have presentations by 3 great friends and partners. We will have a Q&A question and answer discussion with them at the end of the 3 presentations. I would ask all of you to please type your questions in our chat box, and microphones will all be muted. The recording of this session will be available next week at our website, which is www.nhmamd.org. Next slide. We are giving CME, continuing medical education. I know it says CE there. I think that's a typo. Sorry about that. But CME is for physicians, nurses, and others who can get CME. It's a 1-unit CME. And everybody on the call has nothing to disclose. Next slide. So we are very interested in discussing the importance of increasing vaccination rates, especially among the Latino community. NHMA is working with the White House Health Equity Task Force. We just met yesterday for a big listening session with them on the Latino unique characteristics that we have to pay attention to increase vaccination rates. One is trust and transparency. We really need to look at the past discrimination in research, the deportation fear because of public charge, and just disrespect in general to our communities as we develop our campaigns and educational messaging. We also need to have health literacy in the information that we provide in healthcare and in public health. Health literacy meaning, lowering our rates of language, whether English or Spanish, to somewhere like 3rd, 4th grade level, making things simple, application simple, etc. And in terms of physician training, from all of our Latino health professionals have all discussed the importance of patient communication and using community health workers and others in our practices, in our clinics, to have the same messages and reinforce the same positive messages. Medical record reminders, staff health education, and the class standards we put here because we always like to mention the Office of Minority Health at HHS has a culturally and linguistically appropriate services standards that you can see on their website for having a little bit more cultural competence in our healthcare system. Then we have to look at social needs, websites or call lines for appointments. We have, a big need for people to actually have phone calls if they have landlines and can't get text messages or can't use computers, and online navigation, transportation, childcare, Spanish language, etc. And then our media campaigns are starting up, and NHMA is actually partnering with the Ad Council that opens up this week, and also with the Centers for Disease Control. We just received a 5-year cooperative agreement with Johnson & Johnson and with Bio, and we're calling our campaign Vaccinate for All, just to have a different name from some of the other campaigns that are coming out from the AMA's medical associations in different states, and also the American Lung Association, and actually NIH is having their own campaign too. So we're in the middle of a lot of campaigns, but we're very excited. We also have a resource hub on our portal called hispanichealth.info. that we have organized with our sister organizations that are Hispanic health professionals, dentists, nurses, pharmacists, mental health groups, social workers, and others. Next slide. And then, oh, I guess that was it. So I want to be sure and thank everybody again, and please put your questions in the chat box as you listen to our speakers. And it gives me great pleasure to introduce our first speaker, Dr. Barbara Ferrer, a director from the Los Angeles County Department of Public Health, a great colleague and friend. And I know that she's been working tirelessly for months. And I know that there's lots of challenges in Los Angeles. I come from Los Angeles, and salute you, Dr. Ferrer, and all of your staff. And we need to get our campaign to help your county health department especially. Thank you.
Oh, thank you so much for inviting me to talk with you today. And I do want to acknowledge and thank the president and CEO of the National Hispanic Medical Association, Dr. Rios and her staff, for not just organizing this briefing series, but also really for the leadership, for many years now, on helping us sort of recognize the importance of always surfacing the issues that are unique to the Latinx community, but also they're issues that bind us together with so many other groups and so many other communities that have experienced sort of the oppression and racism that really for health has meant life and death. And, we're all seeing that play out right in front of us with COVID-19. I do also want to thank the other panelists, Dr. Aisha Oliver and Dr. Maria Marquez, who are also exceptional leaders in their fields. I'm so honored to be on a panel with you today. I do look forward to sharing some information quickly about efforts in LA County to address the inequities that are laid bare by this pandemic. I'm also going to be discussing how we're working to ensure that vaccines are distributed more equitably, especially to the groups in LA County that have been hardest hit by the virus. And that really includes our Latinx residents, since they've experienced the brunt of the pandemic. And then I'm going to be sharing some data and strategies helping us do a better job at ensuring that residents in the hardest hit communities actually have as much access as possible to the vaccine. I want to sort of give a disclaimer as I start is I think we have really tried as hard as possible to keep equity issues front and center in LA County, but I am not going to be able to tell you a story of success. So if I could get the next slide. We can go to the next slide. I'm going to try to go quickly. This COVID-19 pandemic has shown a stark and disturbing light on the many cracks in our society and the impact of a long history of institutional racism against Black and Brown people that has played out in the ugliest of ways. Throughout the pandemic, there have been significant inequities in terms of the impact of COVID-19 in our low resource neighborhoods and among people of color. Although cases may be declining, as you can see, after a very distressing surge this winter, this does not mean that the issues of racism, lack of resources, and higher risk for adverse health outcomes have gone away. These factors still reveal themselves in the disproportionalities that Black and Brown residents experience every day. This slide does show you the age-adjusted rate of cases per 100,000 people by race and ethnicity. We're going to go back all the way to last April through February 12th of this year. The top line in yellow is the case rate for Latinx residents over time. The gaps, as you can see, are present and they've been persistent almost since the beginning of the pandemic. And they really reflect in part who were our essential workers. And here in LA County, where over 50% of our population are Latinx residents, Latinx residents were in fact the majority of the essential workers. These are the people who didn't get to telework or stay home and actually went to work every day. And at the beginning of the pandemic in particular, when we knew very little about how to protect ourselves. They did, from the very beginning, start, as you can see on here, bearing the brunt. What also you'll see very quickly on here is we've had two surges in LA County, what we call the summer surge in July, and then we had the horrible winter surge. Even in the summer surge, at every point where there have been an overwhelming, for us at the time, an overwhelming number of increased cases, Latinx community has been hit the hardest. Although, you know, as you can see with the green line, Black residents in LA County also hit very hard as well. And you know, just a couple of numbers just to, you know, sort of put this a little bit in perspective. Even though cases are dropping overall and we're really out of surge right now, there is still a large gap between Latinx residents and all other groups. The rate dropped from a peak, the case rate dropped from a peak in early January for Latinx residents, where we were noting 453 new cases per 100,000 people on February 12th. This is a daily number, but it's, you know, which is where we are on February 12th, but this is almost 2 times the rate for Black residents, who have the second highest case rate, 234 new cases per 100,000 people. And Asian and white residents have a case rate of about 180 new cases per 100,000 people. That's like a third less. We'll take the next slide. And unfortunately, as we all know, case rates drive hospitalization and death rates. As it is for cases, the stark disproportionality across groups in terms of hospitalizations is clearly seen on this slide. And again, during the peak of the surges, the Latinx community, and in this case, our African-American Black community saw much higher rates of hospitalization than everyone else. And you can see, in fact, again, as we just run through some numbers, at the peak of the surge on January 9th, the rate of Latinx residents in hospitals was 92 hospitalizations per 100,000 Latinx residents. As of February 20th, the rate has declined to 14 hospitalizations per 100,000 residents. By contrast, the rate of white residents hospitalized from COVID-19 went from a peak of 30 hospitalizations per 100,000 white residents, again, a third of what the rate was for Latinx, to 6 hospitalizations now per 100,000 residents. Again, almost 60% less. Black residents were hospitalized at a rate of 58 hospitalizations per 100,000 at the peak, and since then they've seen a decline to 12 hospitalizations. And Asian residents requiring hospitalization peaked at about 32 per 100,000 Asian residents, and now they're hospitalized at a rate of 4 hospitalizations per 100,000. Next, next slide, please. The disproportionality in cases and hospitalization plays out even in more devastating ways when we look at the rates of death by race and ethnicity. And our Latinx community is bearing the worst from this pandemic. When the surge began in early November, the average number of Latinx residents who passed away each day, that's our yellow line, was 3.4 deaths per 100,000 people. Then it sharply increased to 51 deaths per 100,000 people in mid-January. And as of February 12th, thankfully, the mortality rate has come down to 25 deaths per 100,000 residents. Yet this still remains more than double that of any other group. Since mid-January, the mortality rate amongst Black residents, that was in the green line, decreased from nearly 23 deaths per 100,000 Black residents to 9 deaths per 100,000 residents. Deaths among Asian residents declined from 22 deaths to 100,000 per 100,000 residents to 9. And the current mortality rate amongst white residents is also at 8 deaths per 100,000. And that's from their peak of 17 deaths per 100,000. And while again, the good news is that the rates are declining for all groups, the mortality rate today for Latinx residents is currently 38% higher than it was for white residents at the peak of the surge. And although throughout this pandemic, we made equity a priority in our work to reduce transmission of the virus, it is clear from our data that our efforts weren't successful, especially during the surges. Our primary strategy was centered on worker safety, especially for essential workers and people who do not have the option to work off-site or from home. And we did this by requiring, this was in our health officer orders, it's not a recommendation, it was a requirement, extensive worker protections at job sites, starting with masking requirements back in March to restrictions on occupancy levels and modifications at workstations. However, with hundreds of thousands of work sites across the county, workplace exposures is still a reality for so many of our workers. And given that many lower wage workers live in high density areas and in crowded housing, there are easy routes of transmission from work sites to homes and then back again with other household members to other work sites. Other strategies included opening up dozens of testing sites in hard-hit communities, connecting residents to trusted providers for care, and opening quarantine and isolation facilities at hotels where cases and close contacts could stay while needing to safely isolate and quarantine from other family members. Safety net programs and services were offered by other county departments and our community-based partners to offset economic devastation and food and housing security, but it did not stem the vast inequities I just showed you. We'll take the next slide. Our hope was that as we started looking towards vaccination, that if we created an extensive network of community vaccination sites, and right now we have over 400 sites in LA County, we could secure additional protections for the hardest hit residents. The first challenge was the need to adhere to federal and state prioritization rates. Whereas we might have thought that the most effective vaccination strategy to address the equity issues was to start vaccinating in the hardest hit communities, we have directives from both the feds and the state that suggested a different approach. And I'm not really saying one is wrong or right, I'm just saying that it's very different than going into hardest hit communities and vaccinating everybody in those communities. Right now in LA County, vaccines are available to healthcare workers and people who are age 65 and older, and people who are residents in long-term care facilities. And our prioritization and the ordering of groups that are eligible for the vaccination is in fact dictated to us by the state. At this time, our main challenge in vaccinating in our county is that there's just simply not enough vaccine. And there's tremendous frustration at the lack of available appointments among eligible people who are really told to visit an online registration portal to make their appointments. We do think that with more vaccine, we'd be able to do a better job. But right now, we have a lot of issues and concerns. We do have, because of this vast network, a significant unused capacity to vaccinate. Last week, we had almost 500,000 appointment slots available, and we only had enough doses to distribute to less than half of that, a little over 211,000 appointments. At our large capacity vaccination sites that the county runs, we could have easily vaccinated 168,000 more people this past week. Our strategy does, I think it is important that our strategy remains to have ample capacity so that once we begin receiving more vaccine doses, all of our LA County sites can vaccinate many more people each day. But our ability right now to vaccinate residents and workers does depend on making sure that we get more vaccine. Our network includes small federally qualified health centers who can vaccinate 30 or 40 people a day, to large vaccination sites that have capacity to vaccinate 12,000 people a day. And every single one of them is an essential partner. You cannot do this just with the large capacity sites, especially if you're trying to reach the hardest hit communities. Our providers, we do think they have a unique role to play in the vaccination effort because people are much more likely to go to a provider they trust. And so you'll see in our neighborhoods, we have pharmacies, small clinics, federally qualified health centers, hospitals that can offer clinics by people who are already known and trusted, so that we're not constantly asking people to drive 20 or 30 miles to find a vaccination site where they can be vaccinated. If you hear from a provider that the vaccine is safe, and then you're able to be vaccinated by that trusted person, that would be a good strategy when we get to the point where vaccination hesitancy is the issue. Right now, the issue is access, not hesitancy. I want to go on to the next slide because I know I'm running out of time. But just to give you a sense of sort of, how many different partners we have. This is last week's, sort of what the distribution looked like. And you can see we had 331 sites that were offering vaccine, included acute care hospitals, federally qualified health centers. 144 sites are run by federally qualified health centers and clinics. Pharmacies account for 126 sites. And we have mobile teams this past week. We have 7 mobile teams that are out. And then you have these large capacity sites. We run some, as does the city of LA. They run one very big one. And I'll take the next slide. But as we are preparing to open up eligibility for more and more people, right now in LA County, there's 2.2 million people eligible to get vaccinated. And we've only received slightly under 2 million doses. And everybody needs 2 doses. So you can see, you can do the math. We're short a lot of doses to get the group that's currently eligible: healthcare workers, people 65 and older, and residents in long-term care facilities vaccinated. Starting on March 1st, we'll be opening up eligibility to 3 additional sectors. These include agriculture and food workers, law enforcement and emergency responders, and of course, education and childcare. Amongst those 3 sectors, that adds 1.8 million workers that need to get vaccinated in LA County. And we are not getting more doses. We still get about 200,000 doses a week. We are partnering again with lots of different folks. This really shows like sort of what our strategies are. Making sure people can get to our sites. We've partnered with rideshare folks so they can transport people to sites. We've got pop-ups where people don't need to register. They can just come in. We're partnering with labor unions, obviously, to get to our workers who are unionized, and our labor unions will also vaccinate non-unionized workers. Every single one of our 80 school districts is in partnership with a healthcare partner to be able to partner their teachers and their workers. And we will have sector-specific days at the large capacity pods. So for example, every Saturday, all of the appointments at the large capacity pods that the county runs are open only to daycare workers, childcare workers. On Sunday, they're open only to educators and staff that work in private, parochial, and independent schools, because they don't obviously have the same district framework. On Mondays and Tuesdays, it's open to people who are working in food and agriculture. So every part of what we're doing resides right now on having what we call closed pods that are just for essential worker groups, and then making sure that the vast network that I just showed you of all of those other sites, the pharmacies, the clinics, they just can continue vaccinating their own patients and people in their neighborhoods who now qualify. We'll take the next slide. But this is the problem. So I think what I said sounded appropriate. We've built the biggest network of any county. We have sites everywhere. And then let's look at who got vaccinated. The lighter the color, the less people were getting vaccinated who lived in that community. And if I could overlay this with our vaccination sites, which was just too complicated to do for now, you would actually be able to see that we have vaccination sites everywhere. So in these communities that are the lightest color, they're white, we actually have 57 vaccination sites. But who's getting vaccinated is the issue. So people who you can see, I mean, those of you who know LA, so if you don't know LA, the sort of this white group in the middle is South LA and Southeast LA. West LA, which is where more people have lots of money, they're green and they're dark green. There's no pockets there. We have actually fewer sites in those communities for vaccinations, but those people are able to drive. They're able to stay on their computers and get appointments as soon as they open. As a matter of fact, we had a big scandal because there were codes that were given out to prioritize people in the hardest hit communities, and people actually stole those codes who lived in other communities and used them to get into the vaccination sites. So I'm just really, I want to be completely transparent. We thought we did this right, but I have to show you the map. And the map says that our hardest hit communities, our communities of color, are not getting vaccinated at the same rate as everybody else. So let's go to the next slide. So because of that, we are changing our strategies. Well, we're adding to some of our strategies so that we can actually do a better job. One is any new vaccination sites that come on board are with trusted community partners in the communities with the lowest vaccination coverage. And that applies for our mobile teams as well. Like now it's, these vaccines need to just get into these hard hit communities with strategies that allow for what we call a closed pod, not opening it up to the public. So the only people that can get vaccinated at these sites now will be people who are either patients or live in the neighborhood and have been invited in to get vaccinated. We also expanded our mobile vaccination units. So this week, I think we were in 12 sites, and next week we'll be in 30 sites. And we completely can control the sites that we go to. So right now we've been going to senior housing developments where low-income seniors are living. And we'll continue to do that in the hardest hit communities. We're also doing a lot more community outreach. I'll go to the next slide because I just want to, I know I'm out of time. And so I just want to note that, you know, one of the things we've learned over time is our community health workers are a valued resource in helping to connect people who have little access or poor access to resources, to those resources. So we have been mobilizing community health workers from the beginning. We now have over 900 community health workers that are working with us. And they're really mainly deployed to the hardest hit communities. In some places, they're going block to block by block, to give people information about the vaccination offers and to help them where they need help to get an appointment. And so currently we're booking appointments for residents who live in South and East Los Angeles. And if you had looked at that map, you would see up north in the Antelope Valley, we're also very low coverage rates. I'll take the next slide. And I do want to say, you know, as soon as we started getting data that, you know, from the state that we could look at from their system about who was getting vaccinated, and we were able to see the gaps, we did start making efforts. And if there's any good news, the only good news is that we are finally seeing some decent improvements in who's actually able to get vaccinated. So while the inequities remain stark and they're unfair, when you look at the relative percent change from the week of February 9th to the week of February 20th, you can see some progress. The vaccination rate for Black residents saw the largest increase at almost 45%. For American Indian and Alaskan Native residents, the vaccination rate increased 37%. And for Latinx residents, the vaccination rate increased 32%. This is compared to the vaccination rate for white residents, which increased 25%, and for Asian residents, which increased about 22%. Everybody increased, obviously, more vaccines in people's arms. But we do remain committed to addressing the fact that the gaps in the rates represent inequitable access to vaccines. People have said, oh, this is vaccine hesitancy. No, this is not vaccine hesitancy now. Walk in these communities, people are desperate to get vaccinated. This is the shortage of supply made appointments scarce and difficult, and the way appointments were set up, it disadvantaged people who didn't have time or technology to register for the appointments. So improving access to the areas of the county that have been hard hit remains our priority. And these are areas in LA where Black and Latinx residents live. We'll continue to open new sites, and we'll continue to work with our community partners who are best at innovating what strategies will make sense for us to do a much better job. We always thank our partners for their help and support because they're really the ones that are making a huge difference. I do want to close by thanking everyone for inviting me today, but I also want to acknowledge all the work you've been doing to provide services and support during this most challenging year. So I know we have a ways to go, but I look forward to listening and learning, and deeply appreciate the opportunity to be here today. So thank you.
I'm muted. Thank you, Dr. Ferrer. We're going to go to our next speaker to tell us about strategies from a pharmacy perspective. CVS y Más, Aisha Oliver. Aisha, please go ahead.
So good evening, everybody. I just want to start off by thanking you for letting me join this very important webinar. I'm honored to be on the same panel as the rest of these women, and so thank you for that. So my name's Aisha Oliver. I'm a pharmacist with CVS y Más in South Florida. I'm in Miami-Dade County. And so as a country, if Latinos are 18% of the population, in Miami-Dade, it's about 68%. So it's a very, very large community. And while CVS is a super recognizable name in pharmacy, a lot of people are surprised when they hear about CVS y Más or and more. It just means that we have bilingual employees who are able to offer services to our Spanish-speaking customers. So it makes it just a better experience for them overall. Now, I work in a community that is ranked as having a very high social vulnerability index, according to the CDC. And this basically means that our communities need specific and timely support to ensure healthier outcomes. So what are some of the barriers to those outcomes? That's what I have here on the slide. I've got occupational exposure because we have a disproportionate representation in jobs that are considered essential work. So everything from childcare, retail, agriculture. And because these jobs do not allow us to work from home, they directly increase the risk of exposure to COVID-19. The living conditions. Also, disproportionate unemployment rates can cause financial burdens, which increases the need for families to have to sometimes move in together just, to alleviate some of that financial stress. Also, culturally, we tend to have more, it's more common for us to have multi-generational families within the same house. And now I've always felt that it's a blessing to have abuelita living with us, but that doesn't mean that just because she's there, I need to unnecessarily expose her to the risk just because I have to work outside of the home. Healthcare access, lack of insurance, not wanting to go to the hospital or the doctor because of immigration status, language barriers, cultural differences. All of these contribute to delaying or denying healthcare, and obviously it only can worsen outcomes within our communities. And then the biggest one that I've seen on a day-to-day basis is the distrust. So it's so important how it is that we communicate with our patients regarding the importance of COVID-19 and addressing their fears and concerns, because it's vital to protecting our communities. So the next slide, please. Thank you. This is just something that was done in-house with CVS with respect to vaccine hesitancy. And one of the things that Dr. Ferrer noted was that it's more about the availability of the vaccine, and that's absolutely true. But we still do see hesitancy in our communities. And what we're focusing on is that movable middle. So the ones who want it, great. The ones who are just diehard, I'm not going to get the vaccine. Unfortunately, sometimes I just can't convince people, but that movable middle, that is something that I can work with. And that's the group that I mostly target with the educational outreach programs that I'm involved with. May I have the next slide, please? And as you'll see here, and this also backs up what the doctor was saying, in that very last column, Hispanic, Spanish as primary language, they're the ones who wanted the vaccine the most, according to this survey. Very eager to go out and get this done. When is it going to become available? But overall, what we do see is that there is still a significant amount of hesitancy within our Latinx communities. May I have the next slide? So who is it that they want to talk to? First and foremost, the healthcare professionals. They trust the doctors, the nurses, the nurse practitioners, physician assistants, the pharmacists. These are the ones that, are out there on a day-to-day basis and can educate and inspire that confidence and, just create that kind of environment that allows for people to understand better what it is that would be necessary to help them within their own communities with respect to getting this vaccine. Dr. Fauci, like in all the other studies that are similar to this one, is second, and then the CDC ranking third, and then just kind of goes on from there, people that influencers and things of that sort. But this slide I kept in here just to show that it really is about the conversations that are being had with the healthcare professionals. So just today in Florida, we joined 11 other states in finally being able to offer the vaccine at the retail pharmacy level for people who are 65 and up and for healthcare workers. In my county, we have 67 sites that just went live today, and we're going to be getting customers coming in as of tomorrow morning. So in addition to the great work that is being done in hospitals, at the mass vaccination events and clinics all over the country, we're now able to expand access to the vaccine at the retail level. And it's good because it's already a process that's familiar to people. Most people go to a pharmacy nowadays to get their flu shot, so they already know that they can walk in and get that same service provided to them. May I have the next slide, please? So tonight we're talking about vaccine hesitancy and how to really educate, those in the Latino communities. And how do we address that? So we're looking at the data, we're looking at the reporting. And by utilizing that data, we can identify, okay, so which counties in Florida have that higher social vulnerability index? And those are the ones that we want to have administering the vaccine. And then with that, the vaccine access can expand. We can increase the number of stores and the locations that are offering it, and just hopefully capture a wider and wider target of people. And this data allows us to really focus on those who are in those vulnerable and underserved communities. And we haven't really been able to do that as of yet. So we're excited to finally be on that, in that right direction. The other thing I wanted to talk about is providers as educators. So this to me is the most important. It's what we do as healthcare professionals every day. We educate. Now my role is as a pharmacist, and we're very easily accessible to the community. No appointments ever needed. You can just walk in, you can have a consultation. My advice is always free, and it's an environment that allows for trust and meaningful conversations, and that's of the utmost importance. So how do we best prepare for some of those questions that we can get? And this really addresses the hesitancy aspect of this webinar. So I've always utilized the CDC's website. They are a great resource. Even with our own website, with the Medical Association, you can find a lot of information out there on how to get those conversations started, how to best answer the questions that the public has for you. So while that's a great resource, I thought that tonight I would speak about concerns that some of my customers have expressed directly to me, because it's probably a conversation that you've already had or will have in the future. So typically it starts off with, I heard that, I saw on TV, I read on the internet, and I think personally, this just crosses all cultural lines anyway. But the first one that I always get is, oh, vaccine's gonna make me sick. And the concern here is safety. Is it safe? So I always have to reassure them very simply, no, it won't, senora. I give you your flu shot every year and it doesn't make you sick, it protects you. So even if you get the flu, you aren't going to get as sick, and it'll be shorter. So I just try to educate them about not being so fearful of getting this vaccine. Another thing that I get is, oh, I would just, rather take my chances and get COVID, get it over with, then I'll be immune. And I have to remind them about how this has disproportionately affected our communities. And we need to get more people vaccinated. Quite often, they would rather get vaccinated for their friends or their loved ones than they even would to protect themselves, which is something that I see on a daily basis. So whatever works when it comes to having that conversation, I'm definitely using it. Another thing that we get in the pharmacy setting is because of all the information that is out there. The science part is great, but when people hear anything about mRNA, they get a little bit scared. I've been asked, is this going to alter my DNA? Am I getting implanted with a chip? And these are true concerns that people have. And so I just, again, simply try to explain to them, okay, this is a great resource that we have. We want to get more people vaccinated. You are not going to get COVID from it. It is not going to alter your DNA. It's not a chip. It's nothing like that. That little M just means that the messenger is telling your body, oh, okay, when I see this, I'll know how to fight it. So while we can all explain things as healthcare professionals at a level that we could, understand amongst each other, it's really important how to best explain this, how to convey that message to people I try to aim for about a 3rd or 4th grade level. I find that that's what works best when I'm speaking with my customers. The vaccine was invented too fast. I get that one all the time. And whenever they say that, I tell them, y gracias a Dios, that we have the science to be able to do that nowadays. No corners were cut. The vaccines that we have available to us have been thoroughly tested. And we wouldn't just, put something out there like that. It's been tested, and the one that we are giving to you has excellent studies. We've had millions of doses already administered in this country. And so I just try to really reassure people that it's not something that's going to make them sick, and that it's, we're living in a time when unfortunately this happens, but thank goodness we have so many amazing scientists working on it to get us to the point where we can make this available to people. So after I go through, all of my messaging and educating my customers, now we're looking more at targeted messaging. So with CVS specifically, I'm sure you guys are all familiar. We text message, we email, we call. We will reach out to you to make sure that you're staying healthy. One of the things that we're doing right now is we're really reaching out to those who are in those targeted communities to let them know, look, this is available. In addition to, the text messages and emails, we've got a huge proactive patient outreach through TV, radio, social media, community-based partnerships, vaccine clinics. It's a very robust education-focused marketing, and it's all aimed at increasing COVID-19 vaccination rates. And even tonight, I'm going to learn things from the other panelists that I can then take back into my community and utilize. So we really need to supplement this collaborative effort by focusing on reaching out to those communities. The content is available in both English and Spanish. We recently partnered up as well with the Ad Council to specifically work on education initiatives. And all of these communications are going to work to build confidence in our communities, especially with increasing the vaccination uptake. And while we're still trying to get to that point of making sure that it's available for the people in our community, what we do have, we are very concerned, is it being properly distributed? And that's something that we're working on right now. On a personal level, even if I didn't have a big company behind me like CVS, there are things that I would still be able to do to assist in the community and get the word out. Having conversations with my neighbors, with people at church, with, my friend who works at the supermarket, just really getting that message out there, and then letting people know I was finally able to get my own second dose, and I'm so happy about that. I was telling Dr. Rios earlier that I have my little card on my refrigerator. I'm so proud of it. It's like I got a good grade on an exam, and I put the magnet on it and it's up there and I can see it. So it's a reminder that, all right, I'm done with that, and let me go out and get this for more people, and hopefully I'll be able to have my family on that refrigerator sometime towards the end of the year. I'm very hopeful about that. So I guess with that, I'm trying to say, while I'm one person who works amongst many people trying to get the right message out there, you still can do your part, even if you don't have a giant company backing you up with everything that you do. It just takes, getting out there. And if our lines in the pharmacy today just to get the vaccine scheduled are any indication, then it looks like it's going to be, moving in the right direction. Finally, the convenient access. We all know that there is a pharmacy like on every corner, sometimes across the street from each other. They may not be the same chain, but that's all right. We're all doing the same work at the end of the day. So because we are located in all of these communities, going to the pharmacy to get this done is just, it's a fantastic resource that we can continue when it comes to offering vaccines to the general public. And then the last thing I wanted to mention, going back to some of the conversations I have with my patients, are that, they're worried about like side effects and what is it gonna do to me? So I always share my own personal experiences. I find that it just opens up a better line of communication, and it creates, like you have to display that empathy towards others. So I tell them, look, personally, it hurt a little bit. I got a little bit of a headache, but I was fine. And with the second shot, I didn't really feel anything at all. But that doesn't mean that you minimize it. So you really have to make sure that you're educating them on what the potential side effects could be. That way they're not surprised, and you can maintain that level of trust and confidence. So just got to make sure that we're not only helping our customers get over their hesitancies, but that they're also getting that vaccine. So, just with all the things that our company's been doing, I'm very proud that we finally are able to be in our own local communities now. My personal story with COVID is something that I also share with my customers and friends and family, and now all of you. My husband in 2019 was diagnosed with cancer. And at one point during the pandemic, while he was hospitalized, I wasn't even able to be around him. And so that was a very difficult month, but now he's doing great. So we're very grateful for that. But it would be nice to get to that point where we can look forward to, eventually having a non-virtual Thanksgiving, celebrating, with our daughter when she gets married, hopefully next year, and maybe even one day get to go on a vacation too. So just by relaying these experiences, I think it just allows for me to be able to really reach the people in my community. And it's not just by being on Telemundo or Univision or being on the radio or anything like that. It's those one-on-one conversations, which it sounds like it's difficult when you work in a pharmacy setting, and it can be, but you just have to make the time for that. Making the time for it also means that we have to have people in the building who can assist our, customers with getting this scheduled. Not everyone can work or even has a smartphone. Not everybody has internet access at home. So we make sure that we have a greeter or a concierge. We have nurses who are helping us out. So even if somebody comes in and they're not quite sure how to get it set up, we are able to assist them in creating that appointment, which will automatically create the second appointment that they'll be needing as well. May I have the next slide, please? So now, while the big picture here is get the word out there, educate, empower them to take charge over their own health, and make sure that we're doing it in a way that really speaks to our culture, our community. It's so important. For now, the way to ensure that we take care of our Latino communities and get our people vaccinated is through education and accessibility. So I really hope that through all of our conversations this evening, everybody can continue to go out there, do their amazing work, and just continue with it so that hopefully soon we can get back to some sense of normalcy. I want to thank you all for the time that you've given me, and I'm looking forward to the questions at the end of the entire presentation.
Thank you, Aisha. Now we have our last speaker, who's from a federal qualified health center, to tell us what the clinics are doing. And this is Maria Marquez, Dr. Marquez from Mary Center here in Washington, D.C.
And thank you. It's an honor to be here, especially with these amazing co-presenters. And good evening, everybody. So I'm here representing Mary Center, who is an organization that is was created in 1988. So it has been more than 30 years working with the community in the DC area. And this organization was created to treat and support refugees fleeing Latin American civil wars in different countries and people who were in tremendous need. And it's important for us to describe where we are coming from, because this is what we're, the techniques and the tools and the culture that we are still using and implementing for our communities and our practice as well. So next slide, please. So this is the origin of Mary Center in 1988. Next, please. So our mission, as everybody in the organization embrace, is that we include every community member, every person that is in our communities, always with providing high quality care and social support and education. Next, please. Thank you. And then through the years, the Mary Center had been social innovator in the community, and that make possible to create what we call the social change model of Mary Center. It is something that is tremendously evolving and affecting the community since the conception of Mary Center. At this moment, we do have around 60,000 members, patients, participants in the centers. We do have 5 full services, community healthcare clinics, or centers that had all the programs and all the services that Mary Center offer in each of them. And you can see in the map is still not 100% updated. We opened a clinic in the area that says Silver Spring, and that includes also the communities that are around that area. And we also have 2 senior wellness centers. We have 26 mental health high school services programs in the area. We do have 1 public charter public school in DC that is coexisting in the 3 community centers that we have in the DC area. And those, that organization is our educational partner. And next, please. So I just want to make sure that I emphasize that the social change model, because it was created to strive and approach all health and well-being aspects of humanity, taking care of the whole person as a human being, impacting and empowering quality of life for advancement, building better futures for our people and our community. And this is something that is in our mission and vision every day of our practice. Next, please. You can see that we started a small organization. There were around 10 employees when Mary Center was created in 1988. And currently we are around 725. The budget was, my understanding was provided by grant and also by DC government at the time, and it was around 250,000. And today we are around $70 million entity. We did have 100% patients, participants that were Latins and identify a Latinx population in person. And today we are around 70% Latinx participants. We started the process with the prenatal and services and pediatric, and always questioning the status quo of what the population needs are. And then as being social innovators, bringing changes that are very good, new, creative, and changing making opportunities for everybody. Next, please. So what Mary Center have done as being in the front lines, especially before crisis, during this incredible crisis that we're all experiencing since March 2020. Next, please. So since the beginning, Mary Center have been working with everybody in the community to start innovating into how we're going to continue providing support to the community, offer our programs and offering all these social change model at the same time that we are preparing for crisis and answering and intervening for that moment. So we were testing for COVID since the beginning in March 2020. And in the spring as well, we partnered with the DC government to test the rapid testing in the community. So we have been very involved since the beginning to help our community as frontliners. In our community, we do have around 70% of patients that self-identified as Latinx, and 27% others, and 3% that have not identified or not reported it. Next slide, please. That's what we just talked about it. And then the next slide, please. Okay, so this is what we talk about. We started testing since the beginning of the epidemic. Next slide, please. So I just want to say that 90% of the patients that have been tested in Mary Center has been Latinx identified and self-identified, and then of which this 75%, 90% had been positive. So majority of the patients that have been positive at Mary Center had been Latinx or self-identified as Latina. All right, next slide, please. So also, as everybody maybe know, we have been under the leadership of Maria Gomez. She had been recognized nationally about all her innovations and creations. And she had been partnering with the government, DC government, Prince George County. She had been awarded during this pandemic as well as a leader. And she was one of the members, task forces that were considering the reopening of businesses and making sure that everybody was safe to go back to businesses and as before and as possible. Maria Gomez is our current president, and also she is the chief executive officer of Mary Center, as well as one of the founders. Next slide, please. So one of the programs that was also instituted at that time, again, is always trying to be supportive to the community, was to provide cash assistance in partnership as well with BRIA, that is the education partner that we talk about of our education component at Mary Center, and it's a charter public school in DC. We were able to assist 1,500 families, around a total of $2 million were distributed to families in need that couldn't qualify for the support, federal support. And we prevented a lot of mental health and homelessness, and also food hunger at that moment. So we had plenty of stories of patients that had expressed how this was crucial during these very hard times. Next slide, please. Next, please. So as we have known here in DC, we're reaching around 1.2 million overall numbers of tests in the area, and then of which 400,000 are DC residents. And it has been very around like 1 million. Today is a 1,000 death of patients in DC area with COVID. Next slide, please. All right, so this is again about DC, and one of the things I think other speakers have mentioned is that the infection rate is going down, and also the burden of hospitalizations is going down, and that's good news. And I think is I see it more positively in a way that I think everything is working and helping. Next slide, please. As we know, we have the 2 vaccines. Today, we just approved as an emergency vaccination process, again, the Johnson & Johnson vaccine. Next slide, please. So we started vaccinating with at Mary Center with the Moderna vaccine because of refrigeration possibilities and capability in our centers. So we started with the Moderna vaccine, that is 2 doses in the area. But keep in mind that we tried always to be as equitable, as supportive, and making sure that we also represent our community, as some of our employees are part of the community. We have around 50% of the employees are Latins as well. And we also have 70% of our members and participants are Latins. So I think we are trying to impact the community as much as we can. 7%, according to DC government, have partially been vaccinated, some of them fully, around 4%. Bloomberg's report that DC is vaccinating more than 7%, around 12%. Next slide, please. Next one. Vaccine equity is similar to what was presented. If we can see, the dark purple is the area where maybe more affluent DC communities live, and they also have Ward 2, Ward 3, and they do have higher rates of vaccinations. And we are making all the efforts, and we're going to talk a little bit about to completely reach other other areas that are represented in our centers as well. Next slide, please. All right, next one. So we started vaccinating December 28th, and next one, please. We have around 900 to 1,000, because again, this is not updated in a way that when we did the slide, that was last week. We are vaccinating around 50 to 100 people per day, and of which around 40% of these vaccinations are going to community members. And the rest will be for healthcare providers, for responders, and employees that are in the clinics. Next slide, please. The around 38% of the vaccinations have been self-identified for us Hispanic Latins population. 25% haven't identified themselves, and if we take out the employees, we have vaccinated around 28 to 30% of our community members. Next slide. So we're going to talk a little bit about increasing vaccine uptake, because Mary Center has such a big program and support team that had been outreached by a lot of, we have a lot of outreach possibilities. So we have been partnering with other community institutions, but as well our programming are all kind of focusing on outreaching our community. So next one, please. So we want to make sure that we talk about Salud y Bienestar is an organization in Maryland, and they are providing a lot of testing in the Maryland community at Mary Center and other centers, and they're extremely helpful to also registering and helping register patients. We have a number that they provide. They have a lot of social media campaigns that are very, very amazing. And then we provide the number to the patients and they take it from there, appropriately culturally sensitive and language, and hold their hands as well, because as everybody have talking here, like is we need that help as possible with implementing health literacy to every single community member. Social media campaigns, next one please. We do have access to social media, LinkedIn, Facebook, YouTube, you name it. And we are also encouraging employees to, to support blogging and talking about their experiences, about the vaccine, about their diseases. We talk about the miracle of science, as speakers already have mentioned. This is incredible. It really brings light after the tunnel, and we do give our experiences as well. Like I am one that I share with everybody. We see around 100 patients per week, and every single patient I ask, I am a pediatrician, so my kid and the parent, and I say, do you have any question about the vaccine? I take that moment to express, and some of them ask, do you have them? And I say, yes. And that's the case. I say, yes, is what is described. The side effects are there. It's like any vaccine. I tell them that my last vaccine was the varicella zoster vaccine, and so I'm already confessing my age. And I tell them that, and I say it was very similar side effects. So nothing major. The second one was less problematic than the first one. I don't know why. As one of the speakers already also said, but there is a lot of people who say one-on-one conversation really helps. So we need more. The next one, please. We have events in the District of Columbia with different speakers from Mary Center and discussing about questions about the vaccine and about COVID and about how can we help the community to reach the vaccine. Next one, please. Media, again, we have a lot of media interventions and participations, and we appreciate the opportunity for everybody to help and contribute to these factors. Next one, please. So we do have, again, a lot of open voices discussion. We do also talk about it with employees, with patients, one-on-one. I think the most important in vaccination campaigns is really to address the question. So I encourage every person to ask questions to people they trust. And it can be anybody who knows about science and can answer a respectful and truthful answer for anyone. So it's an encouragement. And Dr. Elliott, who is our Chief Medical Officer, he's very hopeful, as I am, about the vaccine and how everything is going. Yes, there are some concerns about access. The good news today, we have a new vaccine. It's the third one, and we also have around 100 million doses already cooking, and maybe 200 million doses coming, and it's only one dose. You don't need two. The protection is around 72%, so it's pretty good. And then, given all the injustices, we want to make sure why Mary Center had been in the lead and the front line is because we have been doing this since very early of our creation. So it's all about equity, empowering leadership, health literacy, and we have a tremendous support team members, programs that are making this happen.
Okay.
Next one, please.
Oh, one more.
Hello? Sorry about that. And then a one-on-one conversation. Thank you.
Okay, thank you very much. Now I'm going to have everybody know we're going to stay 5 minutes extra. I know we got started a little late. I wanted to ask a couple of questions that have come up more than once. For Dr. Ferrer, You mentioned access is a major problem, and you show the tremendous problems with the Latino community in access. You comment on the undocumented and the issues of messaging to increase access to our community, our families that have undocumented and have more fear than anything. But any strategies that you've been able to use?
Yeah, no, thanks a lot. I mean, I think one of the biggest challenges that we face is this issue about verifications and eligibility in order for people to get vaccinated. And because it's, this sort of priority, tiering that we're stuck with, it's already loomed as a large issue. even just because as people know, just the very nature of asking for identification can, for some people, be so frightening that they would forego the service. We do allow we do allow a fair amount of flexibility. One thing we're really encouraging is because California, most of the residents, even if they may be here undocumented, they're entitled to have healthcare coverage, and the vast majority of folks, in fact, have some kind of healthcare coverage. So one big strategy for us is to really encourage people to get vaccinated at a federally qualified health center or at one of our Department of Health Services clinics, places where people are already enrolled and they're known and they won't be asked for any additional verifications. But a good example is, for example, we're now going to be open up for food and agriculture workers. And so we've been working with our partners to figure out, how would people be able to verify that they are in fact in this category? Because I can be honest, we have a lot of crowding out. So if you don't have any verifications, then we would have lots of people who weren't really in the priority group getting vaccinated. But we will take an attestation, which is really just a letter that a person writes themselves that just says, I am a food worker and I work at this site. And that will be all that will be required for food workers, because again, we don't want legitimate workers to not be able to get in because they don't have standard verification forms, like a driver's license, for example. So we don't, we have tried to, again, make it easier, even with all of this tiering. But I will say it's why our preferred strategy, and hopefully we'll get there one day soon, is just to be able to go into hard hit communities and just vaccinate people who live there. And you don't have to ask anything, if they're living there, they're just going to get vaccinated, and you can do away with the complexity of the verifications. I understand when there's a lot of scarcity that, it is important to make sure that people who are in the priority groups, and those are our essential workers. There's nobody more important in my mind to get vaccinated than the people working in the grocery stores, the people working as farm workers, the people working at our food production plants. Because I actually have all the numbers about how many outbreaks are occurring at these sites. And these folks have been working, they never got the option to not work.
Right.
Not working meant losing your job. So they've always had to go to work, and they really need to have an easy way to get vaccinated. And that includes people who may be here without documentation. So we're very honest, there's no requirement for documentation to get vaccinated in LA County at all.
And the vaccines are free. The vaccines are free.
100% free.
Yeah.
Nobody's allowed to charge.
Let me ask a quick question for CVS, for Aisha Oliver. The CVS y Más, is this a national program, and when did it start, and how can you find out more about it, the CVS y Más stores?
Sure. So CVS y Más started a few years ago. We also have a chain of pharmacy called Navarro, and Navarro was bought out by CVS, but they were still allowed to keep that completely, the Spanish feel, Spanish-speaking pharmacists. CVS y Más is in 5 states and also in Puerto Rico. That's where I'm from. So it's just, it's located in areas, of course, that need that kind of service available to them. So I'm aware that not everybody's familiar with it. It's very common to see a CVS y Más in Miami, South Florida. But I went to school in Ohio. You're not going to necessarily find an y Más next to my pharmacy school up there, but we are in 5 different states now, and like I said, in Puerto Rico as well.
I know they're in California. I don't know if Dr. Ferrer, if you know CVS y Más in any particular area, I went to one in Santa Ana. I happened to see it.
No, I don't know CVS y Más, but CVS has been a great partner in the locations where they're located.
Yeah, I
but-
think I think they have, and it's great that the retail pharmacies were finally opened up as a vaccination access point. For Mary Center and the federal qualified health centers, is there, there's a question about, is there any social, you mentioned social change model, but is there any model for vaccines among all the federal qualified centers? Are they trying to do a standardized approach in terms of messaging for, especially for the Latino community? Is there a campaign, for example, with the clinics? We'd love to hear about that.
So that's a great question. No, we have, everybody's trying to do a campaign and accessing as equity as possible, everybody. So one of the things is we do have organizations around us that are partnering with everybody, federal high quality care organizations. In Maryland, like for example, Bienestar y Salud, we have COVID immunity, we have Black Churches Association. So yeah, they're partnering with all of us.
So it's more local. Yeah, maybe Dr. Ferrer, if you could comment on this. I think what's important that you mentioned safety net services and all of the different services that are, you know, the enabling services of food, and people losing their jobs need a lot more help now, and it's always been a public health responsibility. How can we help with the private sector coming in more? Is there a way to?
I mean, I think this is like always the biggest issue in some ways is, you know, communities are under-resourced and families are under-resourced, and it's not by chance that it's Black and brown people that are living in communities that are under-resourced and that often have, you know, the lowest paid jobs and the least amount of protections and working under the worst conditions. I think in the middle of a pandemic, you know, you need to continue to fight against sort of the forces of oppression and racism, but you also need to acknowledge that there are in fact programs that are needed to help people survive this. And I think there was one set of programs around sort of just building that social protection net for everyone. You know, no one should, like, you know, because they lose a job, no one should end up being homeless. No one should end up having food insecurity, especially because they lost a job because the restaurant closed, because we don't allow people to go indoors and eat because it's not safe. So you can't just say, you know, look, we're worried about this. We're worried about spread of the virus over here. And that's our job as public health people, and not say, but we're also worried about the economic impact that closing our restaurants had, particularly on people with the least amount of resources. So I do think working with all of the partners, and you're right, Dr. Rios, I mean, we need our businesses to be stepping up as well. It's not just government here that needed to step up. There are lots of other partners on this. The one area where we did some, you know, made some efforts that I think were unique is we recognized that, you know, one of the key mitigation strategies in a pandemic with a highly infectious virus is that people need to isolate and quarantine. Isolate if you're infected, quarantine if you're a close contact. You know, that's super hard to do if you live in a house with 10 people and 1 or 2 bedrooms and 1 bathroom. So we did right away set up what we call quarantine and isolation facilities. They're free. And people are welcome to go there who don't have resources to isolate or quarantine in their own homes or somewhere else. And they're given all of their services, you know, all the food. I mean, you have to stay in your room. It's not, you can't go out and have a party there or anything, but you can in fact have a place to stay where you're not going to be in contact with other family members or other people who live in your household while you're, you know, now it's 10 days while you're there for your 10 days. And I think that that works well. And I think it's an important part of a public health response. In other words, you have to recognize like who can quarantine and who can isolate. Right. But the other part of business is like we need paid sick leave, you know, and we need protections for workers who get told to quarantine and isolate. They can't lose their jobs. We can have these resources, but if people are going to lose their job because they were the close contact to somebody who was infected and they're not sick at all, and they have to make a choice between following a health officer order that says, please quarantine for 10 days, or it used to be 14 days, and, don't go to work, and their job, they're going to lose their job and there's no sick pay. A lot of people aren't going to be able to quarantine. So I think we have to be realistic. Like, we need a lot of other supports to help fight a virus that disproportionately is affecting poor people and poor people of color.
Yeah, well, we're going to have to wrap up. I want to just say that one of the questions came up in response to the messages of how important it is not to beat down on our communities and to really have upbeat, positive messages to the extent that we can. The vaccine rollout has actually doubled since President Biden has taken place. There is a light at the end of the tunnel that there will be increasing vaccines accessible through the public health departments, through the community health centers, through the CVS y Más, and all the CVS and all the other retail pharmacies. We have just a quick question. We have a 2-question survey on the browsers. Can you show us the survey, Vincent? Or I can think everybody gets it when you exit. If you can just take a second to answer that question. And then the next information here is just our contact information for the National Hispanic Medical Association and our foundation, NHMA-MD.org. And I'd like to especially invite everyone that has been on the call to our national conference, virtual national conference. It's our 24th annual, and we will be launching our campaign, Vaccinate for All, with the CDC. We have support from Bio, Johnson & Johnson, and others pending. We're also working with the NIH on their new campaign and the Ad Council. And we are going to have media training. I know somebody also mentioned in the chat how important it is to get more of our Latino community health workers, nurses, doctors, all the trusted people that we have in our communities, to get them out in the media. And that's one of the things that we are doing with our Latino health professional groups. And we will include all of them if we can. It's not just TV, but it's also radio. And it's also our National Association of Hispanic Publications, our mom and pop Hispanic newspapers that are still in existence and being read by our communities. And a lot of them have websites too. So we're very excited about that. So with that, I want to thank all of our presenters, Dr. Ferrer from Los Angeles, Dr. Marquez from Washington, D.C. and Mary Center, and Dr. Aisha Oliver from CVS. One last invitation, our virtual briefing series is the last Wednesday of each month. We are skipping March because of our conference, but we will come back again in April, Wednesday, April 28th, and then you can see May, June, July dates. And if anyone has specific topics, speakers, we look forward to inviting the best and brightest from across the country. And we are doing our best to have different types of speakers like tonight. And I want to thank everybody for joining us. So thank you very much. It's a pleasure.
Thank you.
Thank you.
Thank you.
Thank you.